When performing meridian dredging, do the back first, then the front. Prepare materials before operation. Turn on the device and swipe card. Adjust the instrument's temperature to 55 degrees. Both the operator and the customer should remove any metal accessories. Wear gloves and disinfect the probes. Covered with a disposable facial towel. Wet the towel with purified water to 2/3 of its surface. Heat the cream on the probes. Spread the cream. Spread the cream evenly over the area to be treated. When performing meridian dredging, do the back first, then the front. Step 1. Move around. Choose the dredging mode and adjust the level according to the customer's comfort. When performing meridian dredging, remember to apply slow, deep, and steady movements so that the pulsed energy can penetrate into the meridians and body. Horizontal pulling of the lumbosacral area. Relaxation of the lumbosacral muscles can affect the stability of the lumbar vertebrae, easily leading to issues such as urinary incontinence, incomplete urination, and lumbar disc herniation. Check if there are white horizontal lines on the waist or if the lumbar vertebrae are deformed. Position one probe on the belea points and perform a horizontal pull across the lumbosacral area. Repeat back and forth 2 to 3 times, dividing and pushing the lumbosacral area. Long-term tension in the waist muscles can lead to lumbar muscle strain, deformation of the lumbar curve, pubic uplift, bone abduction, which can cause pseudo-wide hips, nerve compression, and neurogenic tingling in the lower limbs. Use 2 probes to push apart from the belea points towards the sides of the waist. Repeat this process 2 to 3 times. Circular motions on the buttocks plus horizontal pulling of the transverse lines on the buttocks. The buttocks are the main switch for 6 meridians in the legs, serving as a bridge for qi and blood circulation between the upper and lower body. The condition of the buttocks reflects pelvic health. Blockages here can lead to conditions like uterine coldness, menstrual irregularities, and pelvic effusions. Observe the overall state of the buttocks, checking for deep color, acne, excessively low temperature, etc. Use 2 probes to circle over the buttocks from outside to inside, focusing on shaping. Check if the color of the transverse lines on the buttocks is darker, indicating insufficient sex hormone secretion, which can easily lead to sexual apathy, endocrine disorders, etc. Use dual probes to simultaneously pull the transverse lines on the buttocks horizontally. Gallbladder meridian. The gallbladder meridian runs from head to toe. Blockages in this meridian can allow dampness and cold toxins to invade, aggravating liver stagnation, potentially causing nodules, hyperplasia, cysts, hip joint pain, and leg pain. Use dual probes to push along both sides of the gallbladder meridian. For individuals with thicker fat layers, apply more inward pressure. Ask if there is any soreness, swelling, pain, or sharp sensations, which indicate blockages or poor flow. Perform this movement back and forth 2 to 3 times. Second step, locate. Switch to the stretching mode and adjust the intensity level based on the customer's comfort. Activate the acupoints. Each acupoint should be held for 60 seconds. Now we will locate key acupoints for activating, caring for the gonadal system while identifying problem areas causing discomfort. This targeted approach makes body regulation more effective and efficient. Mingmen plus Yuyangguan, Shenqiu, Beliao, Yuyan, Juliao, Huantio, Shangfu, Zuozhuan, Huiyang plus Changyang perineal areas. During the process of activating the acupoints, introduce relevant scripts for blocked acupoints. Explain the role of the acupoints. Explain the health risks related to poor circulation in these acupoints, and outline the health problems that the customers are experiencing. Guide clients to feel sensitive acupoints bringing them a sense of experience. Mingmen, if the mingmen is not smooth, it may lead to physical weakness, lower back pain, reproductive problems. Yuyangwan Governor Vessel Key Point, a passageway for yang energy. Blockage here can lead to lumbar soreness, lumbar pain, lumbar muscle strain, lumbar disc herniation, etc. Shenshu, disruption in Shenshu, can easily cause kidney deficiency, lower back pain, edema. Waliao, the main switch for yang energy. Blockages can result in abdominal obesity, menstrual disorders, premature ejaculation, infertility, and other gynecological and male health issues. Yuyan, blockages can cause lumbar and abdominal pain, possibly severe colic, or issues like kidney stones and hematuria. Juliao promotes dampness removal and qi movement. Blockages can cause lumbar and leg numbness, lumbar and abdominal pain, endometrial inflammation, etc. Huantio adjusts the upper body downwards and the lower body upwards. Blockages can induce sciatica and lower limb arterial occlusion, limb atrophy. Changfu protects lower limb function. Blockages can induce lumbar disc herniation, sciatica, lumbar and leg pain, etc. Zhuojian, blockages can lead to premature ovarian failure, sexual frigidity, uterine fibroids, lower limb hypertrophy, etc. Changyang, if Changyang is blocked, it may induce hemorrhoids, constipation, discomfort in the waist and back. Huiyang dispels dampness, replenishes yang energy, improves constipation, alleviates pain, regulates the endocrine system. Perineal, poor circulation, muscle weakness, constipation, hemorrhoids, prolapse of the perineum, etc. Third step, clear. Switch to the moxibustion mode. Exercise mode glandular modine. Switch to moxibustion mode. Exercise mode, gland mode international version. Adjust the intensity according to the client's comfort level. Each point should be held for 60 seconds. Mingmen plus Yuyangwan, Shenshu, Baliao, Yuyan, Juliao, Huantio, Huyang plus Changyang, perineal areas. Finally, activate points on Changfu and Zhuojian, these two groups of sensitive points with good body sensation. Clear the acupoints. Interact with the customer to assess the flow of energy through these points and provide info on the dangers and impacts. Based on the specific conditions of the customer, interact to check if there are still any tender or blocked points. Discuss the potential harms and impacts of blockage, guiding them towards appropriate service packages. Guide clients to feel sensitive acupoints, bringing them a sense of experience. Front, spread the cream evenly over the area to be treated. Step 1. Move around. Lower abdomen. The lower abdomen houses the reproductive system and is prone to accumulation of dampness, cold toxins. Common issues include indigestion, abdominal bloating and diarrhea, pelvic effusion, uterine fibroids, prostatitis, etc. Place one probe on the Zhongwan point and use the other probe to make circular motions on the lower abdomen. Feel the hardness and temperature of the lower abdomen. Ask if there is any soreness, swelling, pain, or sharp sensations, which indicate blockages or poor flow. Perform this movement back and forth 2 to 3 times. Inguinal lymph nodes. The inguinal lymph nodes are responsible for detoxification and immunity. Blockages can lead to toxin buildup, affecting health. This may cause lower limb edema, pain, varicose veins, reproductive system problems, increased fatigue, and reduced quality of life. Use both probes simultaneously to massage the inguinal lymph nodes. Observe if the skin color is dull. Check for any odor. Feel for lymph nodes. Ask if there is any soreness, swelling, pain, or sharp sensations, which indicate blockages or poor flow. Perform this movement back and forth 2 to 3 times. Inner thighs. The inner thighs are where the liver, spleen, and kidney meridians run. Blockages can easily cause numbness, muscle tension, cramps, pain, and coldness in the lower limbs. Gently circle both probes around the middle 1/2 of the inner thighs. Feel the hardness and temperature of the lower abdomen. Ask if there is any soreness, swelling, pain, or sharp sensations, which indicate blockages or poor flow. Perform this movement back and forth 2 to 3 times. Second step, locate. Switch to the stretching mode and adjust the intensity level based on the customer's comfort. Now, we will locate key techniques for activating, caring for the gonadal system while identifying problem areas causing discomfort. This targeted approach makes body regulation more effective and efficient. Activate the acupoints. Each acupoint should be held for 60 seconds. Front, Kihai, Guanyuan, Zhangji, Uteri plus Guilai, 1 probe covers both. Wushu plus Chongmen, 1 probe covers both. Yinfu Guanyuan can use Guanyuan for males plus perineal. Haiyan, strengthen Chengfu, Zhuojian, Sanyin Jiao. Activate the acupoints. During the process of activating the acupoints, introduce relevant scripts for blocked acupoints. Explain the role of the acupoints. Explain the health risks related to poor circulation in these acupoints, and outline the health problems that the customers are experiencing. Guide clients to feel sensitive acupoints, bringing them a sense of experience. Kihai, blockages can lead to symptoms of qi deficiency such as fainting, fatigue, as well as intestinal issues like diarrhea and constipation, and may also affect urinary and gynecological functions. Guanyuan, blockages can result in urinary, reproductive, and gastrointestinal disorders including colicky pain around the navel, difficulty urinating, nocturnal emissions, menstrual irregularities, etc. Zhangji, blockages affect the urinary system, leading to nocturnal emissions, urinary difficulties, dysuria, menstrual irregularities, dysmenorrhea, etc. Wushu, imbalances can cause abdominal pain, leukorrhea disorders, lower limb pain. Chongmen regulates the lower energizer and blood qi. Blockages can cause urgency, frequency, leakage, abnormal leukorrhea, etc. Uterus, blockages can cause menstrual irregularities, dysmenorrhea, infertility, and other gynecological conditions, affecting women's health and fertility. Guilai, blockages can lead to menstrual irregularities, endocrine disorders, uterine prolapses, and other gynecological issues. Mens pubis clitoris. This area contains multiple nerve endings in women. Stimulating the clitoris can promote the secretion of sexual glands. For men, the Guanyuan acupoint can be used to assist. You can apply pressure or use circular motions. Perineal areas. The area around the anus contains sexually sensitive nerves that can stimulate the secretion of sexual glands. Method: 1 probe can be gently moved or circled around the area from the lower edge of the mens pubis to the clitoris. Another probe can be placed on the perineal area, and for men, it can be placed on the perineum and perineal areas. Vulva. Targeted stimulation of the vulva can enhance the movement of the labia majora and labia minora, improve local metabolic circulation, reduces skin dullness, and stimulates the secretion of sexual glands. Activating the sexual glands promotes circulation and metabolism in the intimate areas, restoring hydration, firmness, and a pink, elastic appearance to the skin. In the end, strengthen. Sanyin Jiao, blockages can lead to menstrual disorders, dysmenorrhea, and other gynecological conditions, and may also affect liver, spleen, and kidney functions, causing indigestion, palpitations, insomnia, etc. Step 3. Clear. Switch to moxibustion mode, exercise mode, gland mode international version. Adjust the intensity according to the client's comfort level. Each point should be held for 60 seconds. Front, Kihai, Guanyuan, Zhangji, Uteri plus Gulai, 1 probe covers both. Wushu plus Changmen, 1 probe covers both. Yinfu Guanyuan can use Guanyuan for males plus perianal. Haiyan, strengthen Chengfu, Zhuojian, Sanyan Jiao. Based on the specific conditions of the customer, interact to check if there are still any tender or blocked points. Discuss the potential harms and impacts of blockage, guiding them towards appropriate service packages. Guide clients to feel sensitive acupoints, bringing them a sense of experience. Step 4. Circle. Step 4. Circle. Switch to pure heat mode, any mode with 0 intensity. Perform circular motions over the treatment area for 2 to 3 minutes to soothe the muscles for first-time customers. You can extend this soothing time, guide the customer to notice the improvements in their body.